The name of the program is a school-based health center, and they are in 24 parishes across our state. They were chosen by people who wanted to have this facility in their schools, but they were also strategically, geographically dispersed so that we had people from all over the state that have a school-based health center that's very close to them, if not in their own parish. Some parishes, like East Baton Rouge, have multiple sites. It's really simple. If I was an employer, my employees stay at work. They don't have to take their kids to a doctor unless there's something really wrong with them. And on the other side, if I'm an educator, I'm keeping kids in school because we're keeping them healthy, and when they're really sick, we send them home. For John Q. Citizen, this makes sense because we are helping the educators educate children, and we're keeping kids out of the emergency department and out of urgent care, which is a much more expensive model. Good afternoon. I'm glad to be here with you. I am here talking about some of the most favorite work that I've done in my career. So let's get to it as we go forward. Basically, these are medical offices that are put in schools across the state of Louisiana. There are 63 sites in 26 different parishes. We serve and have visits of students, about 135,000 of them annually. 96% of the time, we send these students back to class, which also means that they are not missing school, so they can stay in school and learn. The sites are located in rural and urban sites. In some of our sites, stay open year-round because they're the only provider in the state. Historically, so that you understand where we came from, this was not a pie in the sky, let's just do this. Robert Wood Johnson Foundation, the largest health foundation in the country, looked at 1 billion office visits of all kinds of providers. And what they saw was that the lowest served population in our country are the adolescents. The perception is they are healthy, but what we know now from studying them is they are practicing very high-risk behaviors that cause major problems in their lives as they get to their 40s and 50s. So we had the funding, the original funding that tested the pilot, if you will, was done in 25 communities across the United States. There was one in New Orleans, and the provider, who was a physician at LSU Medical Center, decided he was going to take the money meant for one health center, and he opened 2. After this 5-year study, we demonstrated the effectiveness of putting medical and mental health providers in schools. And I want to pause right there because that is a very important statement. To my knowledge, we are the only provider type that has both medical and mental health staff in the same location. So when our medical providers have to make a referral to mental health, there is no 3-week or 4-week wait. They go immediately next door to the next office, and the child is seen very quickly. So in terms of how we get to this integrated primary care and mental health model, it's really not rocket science. Our staff, all of us have a medical director, a physician, that could be a pediatrician, a family practice physician, even an internal medicine doc. We all have medical directors, but we also have physicians that go into the sites, Allen School campuses, and provide service every day. The backbone of our model are nurse practitioners. Those are the people who really see the bulk of the students medically that we're working with. We also have nurses, be they registered nurses or licensed practical nurses. And again, the most important part that we bring to the table from my experience is that we have either licensed clinical social workers are licensed professional counselors that are on site working side by side with those physicians, those nurse practitioners, and those registered nurses. What we do is, and most of these things are part of what our national organization calls the core of prevention. We do a lot of what our physicians call well child checks or physical exams, because many of these students have no other provider. We are it. We also do something called a risk assessment, where we're looking at behavior, because remember what I said earlier, their behavior is what's getting them into situations where they're ill and not doing well. We screen for clinical depression. I don't know if you all know this, but suicide is a very high cause of death for teenagers in our state. We screen for chlamydia, which is a sexually transmitted disease. And we also look at body mass index. What that is we're looking for kids that are at risk of obesity, because part of our challenge is that we have a lot of students that are obese. They already have high blood pressure. Many of them become diabetics, and they become a lot of work for our healthcare system. We also, because on any school campus, I don't care what state you're in this country, the highest number of chronic disease patients on any campus is going to be asthma. It tops everything else and always has. So again, when we look at what we do, we have risk assessment, we making referrals to the medical team, we make referrals to the mental health team, and we have those the mental health providers sitting on campus serving children so that they do not have to wait 3 weeks to get to another provider. One story that I have that I think drives home this issue of suicide and suicide ideation. One of our sites, which is in the southern part of the state of Louisiana, in 2016-17, they did 172 assessments for students that might be at risk of suicide. They had 8 students that were hospitalized because they were very serious about their comments about committing suicide. I say to all of you in this audience, be you grandparents, parents, or you have next door neighbors, if you hear somebody think about or say, verbalize that they're going to commit suicide, they need to be seen by an expert provider, because you don't want to take the chance that they really are going to commit suicide. This is data from health centers and schools, so I know it well, because I've always been very interested in the impact of mental health providers on the wellness of the child, but also on what's happening with the academics, because we know that this is a challenge for some of our students in school. This is data that went from 2009 all the way to 2013, and what we're showing you here, these are only students that went into mental health therapy with either an LPC or an LCSW. But what we're showing you is those students' grades improved because we were there helping them overcome whatever that challenge was, and we were able to keep them in school. We also do a lot of things that are considered population health. What that means is, instead of just looking at a slice of people, you kind of look at a whole campus of children and adolescents. Or in some cases, like us in Baton Rouge, we look at the whole school system, because we also are the school nurses. Vision and hearing are the things that we do that are most directly related to education. Because if you can't see, you are going to have a hard time learning how to read. Reading is the key to education, by the way. And if you can't hear, you're not going to hear the way the letters sound, so you won't speak correctly. Oral health, standing before you as an adolescent medicine person, I'm here to tell you this is something that I can make a claim and know that I'm on solid ground. If we look at what's happening to the children of this state, by far and away, oral health is the most neglected service that most of these children have. There simply are not enough dentists. And when they may have a concentration of dentists, as we do in South Baton Rouge for this city, I can tell you, to my knowledge, there are only 3 dental providers in North Baton Rouge. So it's very hard to find oral health services. Another thing that we are into in Baton Rouge, and I had to put it in because it is a population health initiative, a company several years ago created a vaccine for flu that's inhaled. It's not an injection. You literally inhale it. That vaccine was taken off of the market by a committee on immunization practices because they didn't think it was a good enough vaccine. Well, guess what? It's back. 2018, flu mist is back. We will go back to immunizing thousands of children for flu at school. I suspect, because of how rough this past flu season has been, we're going to have quite the turnout and permission from parents to immunize their students at school. Asthma is the #1 disease in any school. I've said that. We have a school asthma management program, and we really are looking at how do we keep them in school. What that means is we run a test called an asthma control test, and we determine whether they are well controlled or not well controlled. All not well controlled students, we call their parents and we call their provider, because we don't want them having a problem with this disease at school. We want them to fall into that well controlled category. We have a lot of strategic partnerships. We could not do what we do without the help of these kinds of agencies in any community, be it hospitals, dental programs, vaccines for children, which is how we get the bulk of our vaccine for the children that we see, because most of our students are insured through Medicaid, and food banks. Some of you might say to me, why in the world would you do food banks? Well, we have a great partnership here in Louisiana, in Baton Rouge, with the Greater Baton Rouge Food Bank. Mike and I work very closely together. Why do we have this partnership? It's because there are 25% of the children of the state of Louisiana that go to bed hungry at night. So I can tell you from personal experience of being even in a more affluent parish that this is the truth. I remember a school lunchroom manager who showed up at the school where I taught at the same time I did, and I got there really early because I'm a medical person by training. I said, "What are you doing here? It's 6:30 in the morning." She said, "You see those kids sitting over there?" I said, "Yeah." She said, "The last time they ate was Friday at noon when they were at school, and this was on a Monday morning." So it's a real challenge about how we conquer this issue of food insecurity. I want to stop right here because I've given you a lot of facts about what we do for children and for youth across the state of Louisiana. But there are some other things that we are doing that are also equally beneficial. We are training the future providers of health care in this new way of looking at how you might want to think about schools, that they're a place where health can also be given. We're training residents. We train in Baton Rouge pediatric residents, family practice residents, and also psychiatric residents. Nurse practitioners, both family nurse practitioners and pediatric nurse practitioners. I might also add to that, we're now beginning to train physician's assistants. We train medical assistants who are the support staff to many of the physicians across the state of Louisiana and to us too. And then we are heavily involved in training social workers, licensed clinical social workers from LSU, as are some of our sites training also students that will become a licensed professional counselor. So, this is a study that comes from, again, health centers and schools. What we have calculated, if a child has to visit a physician outside of a school-based setting, they will lose, if not a whole day, at least up to 6 hours of instructional time. We looked at how many academic hours would be lost if we had a little over 22,000 visits in our school-based health centers, and that was about 135,000 academic hours. What we are doing is keeping kids healthy so they can stay in school and learn, and we know that that is what needs to happen for them. Again, I go back to, we only have 3 ways of moving a student out of a school. They either go back to class, they go home with their parents, or we EMS them if they're in a very critical condition. So I can tell you that this is helping both the education system and the health system. This is where our funding comes from. By large and away, we are in a dedicated fund called the Louisiana Fund, and we have another pot of money that's in a Medicaid LINCA, which is an agreement between the state, the federal government, and that draws down a high percentage of federal dollars. We also have some dedicated federal dollars, and we have state general fund dollars. So we are very concerned about our LINCA funds because that is a place where that makes us whole and gives us the ability to maintain the sites that are across the state of Louisiana. So, in closing, can't wait for your questions. We know we have demonstrated results. We have proven that over and over and over again, as have sites across the country. We are improving the access to care, which this is all about. This is not about anything but access. Adolescents never had access, and when you take away school-based health centers where they are in school, they're going to go right back to not having access. We know that we increase school attendance because we keep kids at school. We're also reducing the cost to health systems from very high emergency room cost and from urgent care visits. We are managing the chronic disease that comes to school. And for most of the people in this room, I think that's the big game changer. We have thousands of asthmatics on school campuses. We have about 100 diabetics on school campuses. And the amount of chronic disease that we are working with students with chronic disease is pretty big. And this is affordable and accessible care for the student because we're in the one place they have to be in this state, and that's at school. And we're also, by the way, just so you know, keeping their parents at work too, because they are out working, earning a living for their children. So if you need more information, I've given you 2 websites here, and I'm certainly willing to entertain any questions that you might have. Currently, we are in the budget all the way. However, we have not come through the special sessions, and I'm not sure that the LINCA agreements are in or out or what's going to happen. So that is our biggest concern.
How much money does that represent?
About $2.4 million.
What would happen if the legislature does not fund that program?
We would lose approximately 24 school-based health centers, maybe a few less.
What kind of an impact would that have on children and their families?
loss of access to care. That's what this is all about. It is about access to care. You won't have those services on your campus. You'll miss school because then you'll have to go to a physician's office. If you're in a rural parish, you may or may not have a physician in your parish. You may have to go 30 miles to get to a physician.
If people have questions like more information, what should they do?
They are welcome to go to our website, the Louisiana School-Based Health Alliance, and there they can find much information they would like to have. If they want to call me, they certainly can. My cell phone number is 225-721-1748.